Okay, good afternoon, everyone. So now we are starting our discussion on validation and verification. I think all of you will agree with me, this concept is a little confusing. People often get confused, ki what is this validation, what is the verification? And understand one thing, if suppose someone is saying, I have done in my lab validation and verification both, that means the person is confused about these terms, validation and verification. Same person cannot do validation and verification both. So we will discuss in brief what is this concept. Now, if you open your standard 15189-2022, in definition number 3.31, what they are saying, validation is confirmation of plausibility for a specific intended use or application through the provision of objective evidence that specified requirements have been fulfilled. Now, if you read this definition and after that, if you read the definition of verification, confirmation of truthfulness through the provision of objective evidence that specified requirements have been fulfilled, both definitions are looking more or less similar to each other. Now, what is the difference? What I want to know here, see, when we are reading some definition, we should be able to get the clear message communicated to us by the author of that particular reference. They are saying confirmation of plausibility for a specific intended user application through the provision of objective evidence that specified requirements have been fulfilled. What they are trying to tell us, if suppose you want to develop a stain for AFB, at present you are using this Zn stain. Now suppose you want to develop Akriti stain. What is
Yes.
required at your level? You will compare the result with Zn stain. Am I right?
Yes, sir.
In certain cases where this Zn stain is negative, but suppose something organism is growing in culture or it is confirmed with molecular study, then you will claim my this Akriti stain is more sensitive than the Zn stain, right?
Yes. Yes, sir.
Now, if you read the definition, what is the specific intended use of your stain? You want to identify
For
AFB in a
identification.
specimen, right?
Yes.
What are the specified requirements? You are comparing result with Zn stain, you are comparing with culture, you are comparing with molecular study, and whatever information you are generating, that is objective evidence in favor of your claim, right?
Yes, sir.
And if suppose after all these things, you are saying this Akriti stain is acceptable to me, or if I am saying this is good for AFB, I am reasonable in that. So I think it is true. Plausibility
Yes.
means reasonable or acceptability. Now it is clear. If you just think in your mind about this example, confirmation of plausibility for a specific intended user application through the provision of objective evidence that specified requirements have been fulfilled. What is your intended use? You want to identify AFB. What are the specific requirements which we discussed? What is the objective evidence data which you have generated? After that, you are saying I am reasonable if I am using this, right?
Yes. Yes.
Hmm. So this is what they have explained in the official language, whatever I have explained to you. Now suppose someone else, one of your friend in Agra or maybe outside, they want to use the same stain. They are not claiming anything, they have not developed anything, but they are confirming your claim. If suppose they are also comparing with Zedenstein, they are also comparing with molecular study, they are also comparing with this culture. So what they are doing, they are confirming your claim. You are saying this is Akriti stain is good for AFB. Yes, we have also checked in our laboratory. So confirmation of truthfulness through provision of objective evidence that specified requirements have been fulfilled. So they have also followed the specified requirement. They have also generated the objective evidence. After that, they are saying this Akriti stain is good to identify the AFB, right?
Yes. Sir.
So this is the difference between validation and verification. This concept should be clear to us so that we are able to understand this in different situations. Now, if you read the standard, now you people just think about this 1 minute in your mind. Now, if you read in the standard, now you have idea. What is the difference between validation and verification? What is the meaning of validation? What is the meaning of verification? Most of the time, what we are doing in our lab, we are carrying out verification because we are already using validated method. So we are only verifying a method. So for that, what is required? You shall have a procedure, whatever you want to verify. Suppose at present you are using GOD-POD for glucose. You want to shift to hexokinase and you are selecting one particular kit. So they have their validation claim that this method will give you precision of 2%, linearity suppose for glucose up to 600, but you want to check in your laboratory whether you are getting these performance, whether you are whatever you are developing in your lab, those performance characteristics, those are close to performance specifications defined by that vendor or not, or that manufacturing company or not. So for that you need a procedure. Because after that verification, you are clear in your mind, you are able to carry out that activity in a required manner. These performance specifications are defined by the manufacturer, and whatever you are getting, those are called performance characteristics. These shall closely resemble the performance specification given to you by the manufacturer. So that means the person who is carrying out this verification shall have appropriate knowledge, competence. What is competence? Ability to use acquired knowledge and skill in practical situation. In addition to competence, laboratory has authorized that person. If you read your standard, competence is mentioned under clause 6.2.2 and authorization is mentioned under clause 6.2.3. So we are here following 15189 only. Now suppose if laboratory is modifying method, then what is required? They have to again check that revised method is providing them correct result. So for that, what is required? Performance specification provided by the manufacturer, results obtained by the laboratory. These are performance characteristics, and you have to see these performance characteristics are resembling this performance specification as closely as possible. After that, you are releasing a statement. This method is acceptable to us. So this is required in verification. What is required in validation? If suppose, if suppose you are developing your own method, as we discussed, AFB, you are developing a method for AFB. So you have to validate that. If suppose you are using some method outside its intended scope, suppose manufacturer is saying you can use this method You can use this method for AFP. But you are saying with some modification, I can use this method for identification of fungus also. For this, manufacturer has no claim. But if you are following this, then you have to claim. Then you have to claim it will give you required result. So you have to validate or validated method subsequently modified. Suppose you're you are carrying out immunohistochemistry and they are saying you have to use the manufacturer recommending some dilution for the antibodies. You are saying we can carry out this in double dilution also. We can carry out in the double dilution also. For this, manufacturer has no claim. Then what is required? You have to validate. You have to claim. In this dilution also, you will get the required result. So ultimately, what is required? This validation shall be as extensive as possible. Ultimately, you have to use this method for the generation of patient result. Again, what is required? The person shall be competent and shall have appropriate authorization. And what need to be maintained in your laboratory, you have to keep the record of all the results which you are generating. You shall have a procedure. In this validation, you are developing the specifications which you want to achieve. First, you are deciding it should have this much precision, it should have this much linearity. Suppose you are developing a quantitative method. So in verification, you are confirming these performance specification, you are developing characteristics. In this, first you are defining and then you are seeing whether your method is able to achieve those specifications or not. And you are keeping record of all these things. And after that, a statement whether you are able to validate that method successfully or not. Sometimes you are developing, suppose, a method. You may say, I am able to validate this in serum, but I am not able to validate this in salivary sample. So like that, you have to make a statement. What are the areas where you can use this? Now, with this concept, you can use this in various situations. When you are accepting equipment under clause 6.4.3, company people, they are saying this machine will give you throughput of 100 tests per hour. This will give you linearity for glucose up to 600, precision 2%. You are checking in your lab whether whatever you are getting, those are close to their claim or not. So what you are doing, you are confirming their claim. So this is called verification. So standard is saying laboratory shall verify. It is mentioned in clause 6.3. Then what is this 7.3.7? Ensuring the validity of examination result. Whatever result you are generating, you are claiming, I have checked everything. The results are okay. What is the basis of those claims? You are participating in IQC, you are participating in IQAS. If you have two equipments, you are carrying out inter-equipment comparison also. So you are sure whatever result you are generating, those are meaningful. Clinician can take decision on that. Therefore, standard has written the word validity because after this, you are claiming you have checked everything. In automated selection, review, release, and reporting of result. See what you are doing. First, you are deciding what all results will go automatically. You are specifying. Hemoglobin between 8 to 15 will go automatically. Less than this, more than this will go only after manual approval. So first you are specifying, then it is approved by the head of the department. And people in the laboratory, they should understand that only these reports will go automatically, not all. Otherwise, what will happen? All routine reports are going, but all critical results are not going. This criteria, you are asking a vendor to develop this. That after developing, checking in his or her capacity, it is meeting your requirement. After that, the person is claiming, this I have developed as per your requirement. When you are checking in your laboratory, whether he has developed as per your requirement or not, I also want to check what you are doing verification. You are using computer, so you are developing your system. Okay, my report should be in this format. I shall have this facility in this software. So whatever you are developing, whatever you are deciding, you are asking a vendor to develop that software for you. But before offering that software to you, the vendor is carrying out certain activities. After that, the person is claiming, I have developed this software as per your requirement. So what he has done, he has validated. You are checking at your level. Whatever he has developed, it is meeting your requirement. His or her claims are correct. So what you are doing, you are verifying that, right? So this is, in brief, validation and verification in different situations. The standard using these terms in different situations. So I thought it is better we discuss how this concept is relevant in different situations.